Okay, this is a model of torso where you can actually view the ribs and then the lungs. This is the two pair of lungs, and then this is the clavicle. Okay, the clavicle bone, and you have the manubrium of the sternum, the body of the sternum, and the fourth process. Okay, and superior to the manubrium of the sternum, this depression is known as the suprasternal notch or jugular notch. Okay, jugular notch. So that's why your internal jugular vein is named according to this notch. This is jugular notch, and then with parallel with the second rib is your sternal angle of Lewis. Okay, is your sternal angle of Lewis, or known as the manubrio sternal joint. Okay, you have the costal and sternocostal joint. This is sternocostal joint. This is the costochondral joint. Okay, costochondral joint, sternocostal joint. So you have first rib, second rib, which is parallel to the sternal angle of Lewis. Third rib, fourth rib, 5, 6, 7, 8, 9, 10, 11 that can be visualized inside the torso. So the blue color here is the costal cartilages. Okay, these are the cartilages which attach your the ribs to the sternum lah. Okay, so the classification of the true ribs and false rib is according to the attachment of the ribs to the sternum. And then you have true ribs from 1 to 7. Okay, 1, 2, 3, 4, 5, 6, 7. And then false rib is the 8, 9, because 8, 9, 10, because each of these actually attached to the costal cartilages of each of the 7. The 9th attached to this 8 costal cartilage, 10 attached to the 9th costal cartilage, and of course 10, and you have 11 and 12, which is rib, which can be seen inside this torso. Okay, so this in between the ribs is known as the costal, costal space, intercostal space. Okay, intercostal space, and you can see the right side of the ribs is related to the liver here. Okay, if there is fracture of the ribs here, it can injure the liver. Okay, if we remove this part, you can see at the back is the two pair of lungs. Sorry, two pair of lungs, and then you have the diaphragm. Okay, and then you can see here in the middle of the middle mediastinum is the heart. Okay, you have to remove the heart, and you can see at the back of the heart, you can see the esophagus, the aorta, and then of course I need to put this first, and of course you have the opening of the inferior vena cava here. Okay, inferior vena cava. So the opening of the esophagus, vena cava is actually at around the 8. The opening of esophagus at T10, and the opening of aorta is at T12. So just remove the internal organ. Remove the internal organs, and you can see you can observe at the back of this torso is the abdominal diaphragm or thoracic diaphragm. Okay, this is the opening of the inferior vena cava just now. You can see also the opening of the esophagus roughly at the level of T10, and of course you have the opening of the aorta here. Okay, this is the celiac trunk. Okay, this is the opening of the aorta at the level roughly at T12. Okay, you can see the diaphragm here. Okay, the diaphragm where you have the white color here is actually the central tendon lah. But the camera have to go a little bit down, but it's okay. Even though if it's focused towards downward, you can't really see the rest of the central tendon lah. Okay, and then you can see some of the structure protected by the rib cage, and also the diaphragm. This is the spleen. Okay, spleen and liver that I already removed just now is quite common to be affected in rib fracture. Okay, you can see the pancreas here, first part, second part, and third part of duodenum. And then just remove this so we can visualize clearly everything inside the abdominal cavity. Okay, so here is the spleen, your kidney. Okay, the kidney on the left side and the right side. The right side kidney is pushed a little bit downward by the liver, and then you can see the abdominal aorta here, but you can't see the right crust and left crust of the diaphragm. You have lateral arch and medial arch at the back of this kidney lah, but you can't see from here. Okay, so okay, that is about the diaphragm. Okay, so if you look at in between the ribs, you have few muscles which arrange from outer to inner part. Is from outer part is the external intercostal muscle. Okay, you have to know the arrangement of the external intercostal muscle, and followed by the internal intercostal muscle, followed by innermost intercostal muscle, and you have another. I'll bring along the. Okay, I'll bring along the anterior part of the chest. Okay, and you can see, you turn towards the back, you can see the ribs here from the internal part, and this is the transverse thoracis muscle. Okay, transverse thoracis muscle. Okay, you can see inside this model, this is the most likely the internal intercostal muscle, external intercostal muscle. This is external, this is internal intercostal muscle. Innermost intercostal muscle you can't see from the anterior part because it's not present here. Okay, but transverse thoracis is present in internal part of the sternum and also the ribs. Okay. Alright, so the rest is actually related to the abdominal muscle. This is the rectus abdominis muscle. This is transverse abdominis muscle. Okay, so this may be the part of innermost intercostal. No, I don't think so. This is also not related with the ribs. Maybe okay. I think we go towards the ribs first. Okay, stop.